was in grave condition. My major organs were shutting down. They had even mentioned that I may not make it.
Few things in life are literally life and death, but undiagnosed diabetes took Rosemary to the edge of death.
I had no primary doctor going into the hospital, and I really didn't know who I was going to get when I came out.
Amistad to me is it's the heart and soul of it. It's not a building, it's everybody wanting to come to work. It's the patients wanting to come here and get healthier. It's the feeling.
Amistad Community Health Center is tucked away on a side street just off 6 Points.
Oh, Miss Marie, how are you doing today?
I'm doing great. How are you?
For Rosemary and thousands of patients, it's become their medical home.
Amistad is my medical home.
I want people to know that they will walk through these doors and they will get the best quality health care.
I listen to your back. Whether you're 80 years old or whether you're 8 months old, we take care of you.
Well, I think the goal is really to try to improve access and to really hone in on providing good quality care.
I'm actually kind of excited.
And I still run across people at the hospitals, oh, Amistad, it's the free clinic.
It's not free care, it's affordable care because we have that sliding scale base.
One of the first things I noticed was that the patients were treated with such respect.
How are you feeling?
Everyone's treated the same, regardless if you have insurance or you don't have insurance.
What side you want to look at? We're available for everyone. We don't turn away patients.
They treat us like people, not a number, and that's real important.
To me, it's kind of like a one-stop shop medical home.
It is a good thing to have different things under one roof, different services.
If I see that they need to go to the dentist, I can send them down the hallway. If I have somebody that has an abnormal pap smear, I can send them to another part of the clinic.
You couldn't do that anywhere else. And so as far as comprehensive under one roof, it absolutely is.
There's a baby head, you see it?
FQHC stands for Federally Qualified Health Center. We're a private organization and we're not part of the government, but the government does qualify us to give certain types of care. FQHCs were established to serve the underserved, and just like Amistad Community Health Center, are placed in areas where there's extra need. But we're not a for-profit entity. We're a take care of people entity, and that's the neat part about being here.
I think there should be more places like Amistad.
All right, thanks.
For my finger sticks, and I have my syringes, and I write down before breakfast what my blood sugar is.
Amistad is getting their patients involved in their own health care.
Amistad has helped me to manage my health, to be healthy, and to stay healthy.
That is our main goal here. We want to help teach, reinforce, and just be available to them.
Showing patients that you care about them, they are starting to care more about themselves and take care of themselves better.
Smoking education is a big difference. Prenatal care. I listen to your back.
Especially for young moms, a lot of them don't know how to actually care for their baby, meaning there's a lot of vaccines involved. And so we'll educate them why it's important to receive the vaccine.
And me being in pediatrics, just parenting makes a huge difference. The neatest feeling is to have these follow-up visits, and they're doing so much better. You got it.
Our belief is that we are a bottom-up led organization, and the people who are on the front lines delivering the care needs to be listened to, and we do that every day.
If there is an issue, we try to fix it. We try to figure, okay, how can we do this better?
We're able now to provide patients access within 3 days max.
I was shocked that within the 48 hours I was able to see the doctor.
So they no longer have to wait 6, 12, 20 weeks to get access to an appointment.
The doctor will be right in, okay?
We talk a lot about customer delight. And what that means is basically making sure that we find a way to say yes to our patients.
They never say no to me or we're booked. I don't know how they do it. It's amazing.
What we're doing is driving down costs.
A lot of what comes with access is that people can't get in until they show up to the emergency room, and now they need their leg amputated below the knee. But they didn't have care, and no one was checking their labs, and no one was educating and things like that, which is where we bring that in. So really looking for that long-term care for the patient, for society. When done right, it's a win all across the board.
All right, so I'll see you then. Yes, ma'am. Okay.
Amistad wouldn't be possible without our funding partners, Methodist Healthcare Ministries of South Texas, United Way of the Coastal Bend, and Christus Spahn Health Systems. Their funding allows us to concentrate on making a difference in our community.
Our collaborative services include Texas A&M for prescription assistance programs, as well as diabetes education programs. And then we have the ecumenical services that provide us with mental health counseling. We also have LabCorp that has collaborated with us in order to provide on-site lab draws.
It's a part of our DNA that patients do well. When patients do well, we feel well. We go home very excited.
It's really neat. I love how my newborns, when I first started with newborn, now they're 4 or 5. And even when they hit the age of 2 or 3, they're always scared of me because I'm the shot lady. But then they get comfortable with me again because they outgrew that stage.
This is an exciting time at Amistad. I wouldn't go anywhere else.
Yes, I wonder.